So we're going to have the first presentation from the mobility coordinator for social services with Johnson County.
Yes.
And Kelly is the coordinator, and she is here to tell us what they are doing to move us around.
Yes, exactly. So like Sunday said, I'm Kelly Schneider. I'm the mobility coordinator. I am with Johnson County, so I'm housed in the social services department there. This position is new to the area. I started in March 2017. My goal is to connect people with transportation. So that looks a little bit different for a lot of different groups, so I'm very flexible on how I provide my services, but focusing on transportation, education, outreach, and all that good stuff is my main goal. So what I wanted to do today is talk about how I can help people become familiar with the public transit systems, and then share some of the different resources that I have that have been translated, and kind of get a feel for, you know, how we can collaborate. So I do have a bunch of things I'm going to pass around here. Start that. So I have my brochure, business cards, and then also a kind of a resource guide that takes a look at the inventory of all things transportation or area beyond a personal vehicle. So going back to that educational component, one of the probably more exciting things that I can do with my position is train people how to ride the bus. So I have worked with a family recently that was just located to the Iowa City area, and actually we rode the bus from the west side of town to here so that she could attend the English class. So that's one of the more exciting things that I can do with my position, is helping people become familiar with that. I will say that when you're learning something new, I can sit and talk to you and somebody can translate that into your language, but when you're actually on the bus and visually seeing the places and the destinations that are on the routes, that's definitely one of the more effective ways to do that. So I'm working with the new AmeriGroup, or not AmeriGroup, AmeriCorps volunteers here with IC Compassion, and figuring out how we can get some of the families trained, either one-on-one or as a family, or we're going to potentially do some fun group outings. So like I said, my services are very flexible. I can work with individuals one-on-one. So if they have a specific destination or their job or something like that that they need to learn how to get to, I can help them get that trip planned. And if they'd like that assistance with coaching, I can also help them do that. So that's about it for my role. Some of the other things that I wanted to share are going to be also on my website. So my website is www.johnsoncounty.com/mobility. I have a bunch of resources about the passes and fares, about Medicaid transportation, discounts, the resource guide that I just passed out to you. All of that is available for download and maintained there. And I can also, you have that written down, so okay, great. One of the, there's been a couple of different resources that I've had translated recently into French, Swahili, Spanish, and Arabic. So those are the 4 core languages that we identified would be necessary to translate some of these guides into those languages. So the first one that I have, and I do have some copies of this, is the non-emergency medical transportation. So how many of you know what that resource is? A few of you? Okay. So what non-emergency medical transportation is it's a program for Medicaid recipients that have full benefits. So this is a added bonus to their healthcare coverage where they can get door-to-door transportation for free to their Medicaid appointments. So anytime somebody's enrolled into the Medicaid program and has an appointment, they can call 2 days in advance to get a free ride to their appointment. So this, yes?
So does someone have to be a Johnson County resident?
Anybody in the Iowa Medicaid program, so it's throughout the entire state of Iowa. If they are enrolled into the full Medicaid benefits, they can use this program.
So this program, but would mean if it's medical, there's to the, say for example, the hospital here to anywhere where they live, or it has to be within Johnson County?
It does not have to be within Johnson County. So if you live in Johnson County and you have a Medicaid appointment in Lynn County or Des Moines, you can still use this service to get there, as long as it's a Medicaid appointment that you're attending.
And full Medicaid would mean what?
That means that you have full health care coverage, so not Iowa Wellness, not a Medicare savings premium plan, but the full benefits. If someone's not aware what type of Medicaid they're on, there is several different kinds, so it can be confusing. I do have the information of who you can call and ask that. So the keyword there would be to say, am I enrolled in the non-emergency medical transportation program? So this guide that I have with the little red suitcase and the wheels on it, this is gonna explain the ins and outs of using that. Also, if members have their own vehicles or somebody's giving them ride, there can be gas mileage reimbursement for that too. So this document is one that I had translated into French, Swahili, Spanish, and Arabic. So I brought a few copies of each of these, but not enough to pass around, so I'll probably just set them on the table back there. But the key is refugees, when they're coming, I've learned that they are enrolled in the Medicaid program. So getting that door-to-door transportation to their appointments is something they can do. They can bring their dependents with them if it's their dependent's appointment. There is a little bit of a learning curve to calling. They do ask you a lot of questions. So I have that information on the back about all those questions they're gonna ask you. You can't just say, I'm going to the university hospital. You need to say, I'm going to 200 Hawkins Drive, Iowa City, Iowa, 52242. So you gotta have a lot of information. So if you're working with individuals that are new to this process and can use that extra coaching, that's also something that can help them do. So it is kind of a little bit of a learning curve to use this resource, but once you get familiar with it, it's a great thing to know about.
So one more question.
Yes.
Is there a time frame you have to call beforehand?
Yes.
And does the transportation wait for you to transport you back, or is that arrangement also have to be
So
made
when you're
separate?
booking the appointment, they will ask you if you know how long the appointment expects to last.
Okay.
If you don't, you can call when the appointment is over.
Okay, and how much in advance do you need to call for an appointment?
I think the better, the more notice you can provide would be definitely the best. But if you know,
At least the ones in Lynn County, they typically say we have to call with 48 hours before. And if it's within that 48 hours to the time of the event, it's dependent on their availability. And we haven't always had the greatest luck within that 48 hours and the time of the appointment.
that's a good point. It probably depends on the transportation provider that's doing that ride for you. So let's say, for example, it's Yellow Cab of Iowa City. Yellow Cab may agree to say, okay, just give us a call directly when your appointment is over. So it does probably depend on who's actually going to be giving that door-to-door ride.
Because I will tell you, in Polk County, where I used to be for the longest time, they have a 3-day notice for transportation.
Yes, absolutely.
And so, and a lot of our immigrants and refugees have no concept of, a part of the work we
Yes.
do is training them to understand what time means and
Yes,
how
it
they
does
need to
take-
have that, because it's a very different setup for them. So, is there a hard and fast rule for Johnson County, or is that, flexible, or is it, I know you say the earlier the better, nobody really.
Right. So it
in our
does require some
communities.
planning. Two business days is the general guideline for this.
Okay.
Okay,
Okay.
so I can tell you, I have worked with multiple people that have not had that 2-day notice. It's taken a lot of navigating to figure it out, but we have been able to get short notice trips approved.
A max number of passengers that they would be able to approve without health plan approval. So if it is a 5-kiddo situation, sometimes that may take a little bit more lead time
To find a
than the 2
provider that
days,
can
yeah.
accommodate.
Or they may say no. So, just,
Sean Paul?
sorry to jump in.
But before I can ask a question, I'm gonna ask a question from the one from the Catholic Council. How long does it take for a refugee to get the Medicare?
Depends. So for a refugee to get Medicaid when they first arrive,
Yeah.
we're required to apply for Medicaid within the first 10 days, that are 10 business days that are refugees in the country. And then, once we turn in the application, the way that Iowa Medicaid is processed, it gets sent out, it doesn't stay in our local offices anymore, so it gets sent out to whoever's processing at that time. And we've run into a couple of hiccups with, some people not completely understanding refugees being eligible for Medicaid, things like that. But typically, once they receive the application and begin processing it, they have 30 days to make a decision. So it can take realistically like 6 weeks for Medicaid to be approved, but the Medicaid is active starting the first month of the day that they arrived.
What happens if you do not apply within 10 days
Then we're not in compliance with our grant.
Okay.
and you cannot get,
They-
you would not be eligible for Medicaid?
They would
after
still
that?
be eligible, we're just not in compliance with our, federal requirements then. But they would still be eligible from the first day of the month that their application was submitted.
So the problem would not be with the refugee, but with the agency.
Yeah, it would be our battle to fight, but they would still get eligibility, which is good, that they've still got that access.
So when you say eligibility, you mean you'll apply for them
Mhm.
regardless, and
Yeah.
then it just gets probably delayed.
Yeah.
Sorry, I have to introduce myself. I walked in, and my coworker, my new coworker, my name is Alta. I am an advocate and the assistant director in Iowa City of Monsoon, long name Monsoon Asians and Pacific Islanders. In solidarity, we work with victims of domestic violence, sexual assault, human trafficking, gender-related homicide in the Asian and Pacific Islander communities in Iowa. But we've been serving nationally and internationally as well under our various programs. We've been around since 2003, by the way, and in Iowa City since 2010. I know a lot of people don't seem to know us, but we're here, going to be staying here, and you better know us. And my coworker can introduce herself.
Hello, my name is Deanna, and I started working a few weeks ago at Monsoon. I'm a multilingual advocate, and I speak Japanese and Korean and English. Yes.
That's it. So Deanna and Lata, if you see us around, say hi. I know you know some of y'all.
Did you have another question?
Yeah, now my question is to you. Is
Yeah.
there any other arrangement for a refugee who doesn't have the Medicare to use your service?
Is there any other, what?
Yeah, arrangement. That can be done.
If they don't have
Transportation
Medicaid.
arrangement
Oh.
for refugees who have,
Who
don't have Medicaid.
don't have the Medicaid, who just arrived. maybe-
Beyond medical appointments?
Yeah,
So right now, there is one public transit discount that I'm aware of. So that's the other thing I was gonna talk about is how to save money riding the bus. So currently between Iowa City Transit and Coralville Transit, what the two systems do have in common is they have discounted fares for seniors, and then they have discounted fares for people with disabilities. So the definition of disability is physical or mental health. So as long as a physician can agree that that person has either some physical or mental health disability and checks off on that, they should be able to ride for free. Coralville Transit for free anytime, and then Iowa City Transit for free during their off-peak hours. So I do have a document that explains that in those same languages that I was mentioning. But then Iowa City Transit also does have a low-income pass where individuals that are enrolled in the food assistance, childcare assistance can apply for the low-income monthly pass, and they can get the monthly pass for $27. So it's not the greatest discount because the monthly pass full price is $32. So they're really only saving $5 a month. But the next thing I wanted to talk about was the transit study. So Coralville Transit, Iowa City Transit, and Canvas have all teamed up to do a review of their system, and they've hired a consultant to determine how to make the system more effective. So I hope that I don't have to have a front and back page paper that explains all the discounted programs, and that we can get them on the same page, and provide a better opportunity for those that are low income. So right now, that low income pass is the only pass that I'm aware of in this area that provides that assistance. One of the more exciting things about the study is Iowa City Transit is considering going to a zero fare system. So that means they would be free for everybody to ride the Iowa City buses. So we're in the middle of a study right now, and there's an opportunity to weigh in on the survey that's open through this weekend. So I wrote it down on here. It's kind of really hard to see this, but the website to complete the survey is iowacityareatransitstudy.com. So that survey link is available through this weekend. On that survey link, users can provide feedback on what they want to see out of this system. So if they want Sunday service, they can select that as an option. If they want later and earlier Saturday service, they can select that. Earlier service during the week, more frequency, more bus shelters, better lighting. They get to pick and choose which items are most important to them. So iowacityareatransitstudy.com is a place where people can weigh in and provide that feedback. Yes?
Yeah, it'd be nice, Leah, if that could be sent out to the whole group.
The whole group.
Yeah.
Then everyone would have an opportunity, because it sounds like it's a very timely thing. We have to
It is,
act
yeah,
on
it
it
is
right
a
away.
very short
and I
timeline,
think
yeah.
it would be a good
And then from there, what's gonna happen is once they get all the surveys, information, and that closes, the consultants are gonna put together 3 different concepts. So out of those 3 concepts, people will then get to determine, okay, this is what I like out of this concept, and this is what works best for this one. So, yeah, it's definitely a good opportunity to weigh in. The systems haven't really evaluated their services for a long time, so they're considering, what service area they're providing. So for example, some of the parts of town that have grown, like Alexander Elementary School right now doesn't have any bus service over there because it's on the south end of town. So that's some of the things that they're going to be looking at. Also, I think the most exciting part for me is they're exploring some alternative methods beyond the traditional 40-foot fixed drop bus. So how can we either partner with rideshare companies or local cabs, or have smaller fleet to be able to help people in some of those late night or early morning situations where you don't necessarily need a full 40-foot bus to be able to get someone from point A to point B. So.
Kelly, what is the actual final date that we service?
So for the survey, it's this weekend. They just said Thanksgiving weekend, so I don't know if that means Friday, Saturday, or Sunday.
Okay.
Yeah, so, on
do it as soon as
Thanksgiving
possible.
weekend is what I've been told. Then I'll keep you guys informed on, when they put together those 3 different concepts that they're gonna be looking at, so. Yes.
And what is the group that's doing that survey?
So the name of the consultant is Nelson Nygaard. So it's a Seattle-based company that Iowa City is the primary agency that's reviewing, but then also Coralville and Canvas have also bought into this.
I was just curious if there was some site we could go to and find out exactly what that deadline would be.
Yeah, so if you want to check out,
It doesn't say, that website doesn't
so
say.
the website that I gave you is specifically for the
For the
survey.
survey,
If
yeah.
you, I can send out an email that has like each transit agency has their own informational page about that.
Okay.
So Iowa Cities is probably, IC.gov, don't quote me, but /transit study, but there's a way to find that link there. And I can definitely connect you with that so we can spread it out to the group. But the iowacityareatransitstudy.com is the link for the survey where you can weigh in about Sunday service, later service, and all that good stuff. So yeah, I think that's the last thing I wanted to talk about, except for.
I'm curious about the survey because I'm curious how they have reached out to get the input of the users.
Sure. So they had they had public participation events, so I've sent emails myself, and then I've been to several different like community meals to talk about the study, and I have a tablet and I bring that. We've had them available in our office. Tomorrow, I'll be at the Crisis Center Food Bank, allowing people an opportunity to do that as well. But I think sending it on to Leah so that it can get to you guys and then to everybody else is just kind of the best way to do that, is the word of mouth. Yeah. Is that what you meant?
Yeah.
How do we get the word out? Yeah.
Yeah, especially to those who don't even speak English and who are not even computer savvy. You've answered somewhat when you
Yes.
talk of community meals.
We did it here at I Seek
Yeah.
Compassion at our community meal on Wednesday. And so we had some interpreters, they had printed them off.
Nice.
Or instead of doing it online, so
Yes,
people just fill it
that's
out in
good.
paper form. Yeah, we had interpreters there, if people didn't understand something or had questions. That's how we did it, just at our community meal, so that we knew there were a lot of people coming and that we would have help.
And if you have anybody that would like to provide feedback and isn't comfortable with the technology of doing it online, I'm happy to help them with that, or help you so that you can
No,
teach them.
I will go do it now that I know, but because I didn't have the information, now that I do, I just wanted to know how you're
Yeah.
reaching so that whatever gaps are there, because I do know some of my clientele, if I'm hearing this for the first time, then some of them have not even had, and they really need to get their input there, because they're impacted, by the outcome of the survey. At this point, Sunday, can I introduce myself? I'm sorry I came late. And
Yeah,
I'm
okay.
sorry.
If you can do that quickly so that
Yeah, real quick.
we have a second presentation.
Yeah, just real quick. My name is Wangui with NISA African Services. We serve survivors of domestic violence and sexual assault who identify as African. And our volunteer has also come late. She is our student liaison and our youth outreach in the community and in Parkwood and in the university. She will introduce herself.
Hi everyone, my name is Tuluwani and I'm a student at University of Iowa. Nice to meet you. I thought this started at 8:30. So
Okay.
yes, the information I got was, maybe I might have heard wrong.
It starts at 10 o'clock. Thank you so much.
Okay, and one last thing that I wanted to talk about is North Liberty. So North Liberty has started their own transportation assistance program. So the city has been struggling to figure out how they're gonna provide needs to their community. So they are rolling out a pilot that's just starting this week, where individuals that don't have a vehicle, are low income, are temporary disabled or disabled, can get door-to-door transportation to essential quality of life services. So that is a Brad. Yes.
Can you provide that information so that Leah can send it out?
Absolutely,
So that
yes.
everybody has the information.
I only have 2 brochures right now. I apologize, but I do have a link to this, or a file to this brochure if you'd like to print it off. But I did want to pass it around just in case anybody wants to take a picture. The city of North Liberty has contracted with Yellow Cab of Iowa City. So it's Yellow Cab of Iowa City that's actually going to be providing those rides. It's only $1 for the user. So you must be a North Liberty resident and then fall into that criteria of not have a vehicle, low income, disability, or temporary disability. They have limited funding right now, so they are not using where the trips are going are to essential quality of life appointments. So there's a little room for interpretation there. Court, DHS, medical appointments, grocery stores, banks, those are all up for grabs. So you can connect to other public transit stops like the 380 Express bus or things like that, or the Coraville Mall. They do not have enough funds to use it for employment. So unfortunately, it will not be able to get someone back and forth to work right now. They are going to evaluate the usage of this program and determine, how they're gonna plan for their future, so. And yes, I will definitely send that to you guys. And that's all I had. Thank
Well,
you.
Thank you so much. Just like us to just switch gears now, and if you have any questions after, you can meet Kelly. our next presenter is with the Domestic Violence Intervention Program. Alta Medea-Peters is the Director of Community Engagement with this program, and she's going to tell us what they do.
Yeah, so thank you so much for introducing me. I'm Alta. I'm with DVIP, or the Domestic Violence Intervention Program. We partner with many of you and your groups, and are able to do the work we do because of that partnership. So first, I want to say thank you to all of you for the work that you do and helping victim survivors in each of your communities. I did bring our general brochure, and I had a PowerPoint and stuff, but I think the conversation part and just answering questions specifically is going to be probably more beneficial to this group. This is our general brochure. We have started translating it and all of our other documents, so red flags, how to help a friend, power and control wheel, into multiple languages. We have now officially on our website, we have an entire Spanish page dedicated. We are moving to French next, and I have my card, so if anybody is willing to translate in other languages, we would greatly appreciate that, and I will pass that around as well. Our goal is to by the end of the year, have those 4 core languages available for our brochure and information, so that is easily accessible to everybody. DVIP is celebrating its 40th year. We started in 1979, answering the need to our community. We received a grant to investigate whether or not DVIP was needed. And within 24 hours of receiving that grant, we had more than enough individuals seeking services. They would go to their churches or to families, but their abuser would find them there, and they were not safe. And so we opened our first shelter in 1980. Currently, we have a shelter here in Iowa City. It is a 40-bed space, very much dormitory style, with youth programming and advocacy. We are 24 hours a day. We are full every day out of the year. In the past year, we've helped over 1,900 individuals. We serve not just Johnson County, and I think that's one thing that a lot of people forget or don't know. We actually serve southeastern Iowa. We have 8 counties, so all the way down to Missouri and all the way over to Illinois, and offer mobile advocacy. So we actually will go to individuals where they are. You don't have to come to us. You don't have to come to our office. It's wherever an individual feels safest to have a conversation. So for some people, that might be shopping at the grocery store. That's a safe space that they can go to on Tuesday evenings, and so our advocate will go, and often they'll do their grocery shopping too with them. And it's a way to have a conversation and safety plan without really setting up any red flags or causing, any distress in that way, or transportation issues. I wanted Kelly to go first because transportation and accessibility are personally just super important to me. I work with the Chamber of Commerce on the transit study right now. And also just seeing it in our clients' lives, understanding how that barrier to being able to get to work or to doctor's appointments really affects lives pretty greatly, so thank you. We have the state's only pet sheltering program in an emergency shelter. So if you have individuals with pets, that about 48% identify that they won't leave an abusive situation out of fear of their pet's safety. We actually have a space for them to bring that animal along with them. Through an anonymous grant and FAIR and Red Rover, that program was able to be created and sustained. I guess I would like to open it up to some questions. I know there's differing degrees of knowledge about what we do, so I want to make sure that I answer your specific questions and needs. Is there any? Some of you I think I just presented to like a month ago too. It's in October. How many of you know different services we provide? That's always a fun one to do. Can you name some of the services DVIP provides? Yeah.
Well, I've encountered certain individuals looking for work that are currently or residing at the DVIP shelter, and they're trying to get back on their feet. So I've come in contact with some of the people who've helped from your services.
sort of fall under resource gathering, finding employment. Economic abuse is 99% of the individuals we serve have economic abuse, so they have no means of income, often no car, no access to things on their own, and so they've often been out of work for a long time, isolated, and so getting them back into the workforce is a super important part of what we do. Finding housing sort of falls in that resource gathering space, and connecting them with other agency programs. And what other services do we provide? I sort of gave you some hints, but yeah.
Should I say because I know?
I know, I don't know, I just had like a long
So I'm
meeting
going
with lots
to,
of stuff.
but maybe one of the things I'll venture, and maybe I don't know actually everything you'll do, Alta, but because we are sister organizations in many ways, we know what they do. So direct services, for instance, huge component of serving victims. That means taking them for, if it's a protective order, if it is getting a pro bono lawyer, if it is taking them to court to work with lawyers, if it's immigration issues. Also, besides helping the resource sharing with jobs and government benefits, etc., also support groups. You'll have strong support groups which are important because the counseling, I don't know if you have a therapist on staff, but counseling, because social workers who are not therapists, there's advocacy-based counseling, which I know Monsoon does, so I'm sure you'll do that as well because that's part of the work we do.
Yeah.
You have a prevention program, or you're starting out, or something?
Yeah, so there's, before we move past the support group part, I do want to bring that up, so thank you so much. The support group, we have both in shelter, and then we also have an outreach support group that's on Monday evenings at 6 p.m. We just ask that people call to let us know that you're coming, and so we know how many snacks to have there, in all honesty. And if you have kiddos, we offer childcare with that, which not a lot of people realize, and it's completely free and confidential. And we're really grateful that we were able to restart that outreach group again, because we had it in shelter, we've always had it in shelter, but once you leave that situation, or if it's been years later, there's still stuff. There might be custody things, there might be some problem solving, and it's really good to have that peer-to-peer with an advocate, and then also having your kids entertained at the same time. So that is something we offer.
So is the shelter, is the support group closed or open?
It is
or
open,
semi?
but you have to tell us you're coming. So it's
So
open with a reservation, I guess. It's just calling and letting Mara, who runs the program, know. So it's very simple.
Okay, so my question was because of confidentiality. Is it a support group that is a closed door or an open?
It's closed.
Because Monsoon has some that are closed door and some are open because they could be community members who want to be part of sharing there. And so, immigrants, refugees who need
Right.
that kind of support but are not ready to disclose as yet. So,
Yeah, so that's,
right.
I would say it's more closed than. Mara keeps track of that. She's the facilitator of that program, and so when you call, she asks a couple of questions to make sure that everybody is safe and feels supported and not sort of being outed in any way that they don't want to. We also have sort of some youth stuff that we do, some youth programming that we work with children that have witnessed abuse or been abused, and we do a lot of art therapy work with them as well. That is sort of a big part, and that's, once again, that's at 6 o'clock on Mondays, and please share that with individuals that you work with. It would be great to have some more attendees there. We have a lot of space and resources for that program. Other things that we offer or do from anybody else? Yeah.
So those support groups are in English?
They are in English, yes, currently, yep. At this time, we would love to expand that though.
In relation to that, I want to add one of the services that we work with you, we
Yeah,
as sister
yeah.
organization. So one of the things they do is an African survivor gets to your shelter first or to your services first, they always let us know so that we work together.
Yeah.
And when they're talking about the support groups, we work on that. Especially if somebody doesn't speak English, they speak Tigrinya or Shona or whatever else they might be speaking.
Good question. Do your programs provide emergency shelter, or that's what you're saying? People would say with DVIP, and then you would be able to provide services.
We
For people
first of
staying.
all, our first place right now is DVIP, but right now we just got our transitional housing funding, but it's not rolled out yet, so we are still using them. And sometimes we get a client who has, because they have a time period they can stay. But one good thing about working together is even if that period is over, we still have conversations on she still doesn't have anywhere to go, and being on the streets is not really an option, and we work together on what to do. And on our end, if they completely have exhausted everything they have, and currently DVP is explaining funding has not started, the short of funding, what we'll resort to is asking around with all the other shelters and working with Monsoon and anybody else, and if it all doesn't work on our end for right now, we get them a hotel as we work out all the logistics of making sure that the survivor, and a lot of them usually have little children, and right now it's cold, and even if it isn't cold, we really don't want somebody living in their car or out on the street. Yeah, I don't know whether I answered your question in so many words.
Yeah,
Yeah.
I think that was a good answer.
Yeah.
With that sort of partnership and being able to call other people in, and that's why we're trying to broaden that, because a lot of times after we've been around for 40 years, so people will contact us first, and it's always great to have those partners to be able to say, you know.
And of course we teach each other.
Yeah,
Yeah.
absolutely. Speaking of the phone, and that's the part that I always gets left out when I ask this question, we have a 24-hour hotline that's available to anyone, whether you're the primary victim or not. So if you are concerned and you don't know how to help a friend or someone in your church or who to call, you can call that 1-800 number and get some guidance on maybe some language to use when you're talking with a loved one, a daughter or a brother or whatever. So as a secondary person involved, you can also call that 24-hour hotline. 7 days a week. It is 1-800-373-1043, and we will connect you from there. We put that number on everything because you never know. The number one way that victim survivors find out about services is through word of mouth. I mean, it is just the foundation of how we operate. You don't necessarily, you're not going to Google it. You're not going to open the phone book most likely and look us up. You're going to maybe tell someone you trust, someone that cares about you or that you see every day and have built that relationship with. And that's why it's so important for us to be here and share this information and share that phone number. So that's the big service. So we have our emergency shelter, support groups and outreach, advocacy, sheltering, and the hotline number. Are there other
So
questions?
closely related to that is the whole issue of you. I know that there's a lot of privacy involved in your work because of security issues and several things like that. But you've talked about word of mouth and the fact that it then seems that the community needs to be involved in this, and the fact that we need to know that you exist and that I can refer a friend. What forms of outreach do you have besides meetings like this to reach out to the community?
So a lot. So that is essentially my job. My position was funded by an anonymous grant about 2.5 years ago. There's a team of 4 of us now. For the first year, it was just me alone. Our goal is to go to where people are. So we attend county fairs, especially in our rural communities. I've been to about 20 county fairs in the last 2 years. We do different events at preschools. I go speak to parents while the kids play, playgrounds. I I did a mental health fair. We sort of, wherever anybody will be, we try to be there. So working with the South District, we will actually be at some of those meetings coming up. We'll be presenting to them, just doing different things. So I am more than welcome. I encourage you. I love to learn, and I would also love to share our information with your groups that you work with. We work with a lot of student organizations as well, so I pretty much, it's, my team always jokes that I never say no, and they find that a little annoying. Yeah.
And how can we schedule that with you guys?
So my card got passed around, I believe. If you didn't get it, just snag me afterward. And yeah, just let me know. Yeah.
I asked that question.
Oh,
sorry, were you
No,
asking?
go ahead.
Okay. I asked that question because a lot of some of the events you have listed are probably not events that refugees and immigrants would go. I've been here for a very long time. I've probably gone to the Johnson County Fair only once.
Right. Well, yeah, and like I said, that's why we're doing other spaces.
And I think that, I mean, there are several organizations.
I lived here my whole life, and I didn't go until they paid me.
Okay, so I'm not the only one. Yeah. So I think that I'm asking that, I asked that question also so that we can pass the information that if there are groups here that represent, especially the immigrant and refugee, that they can call you to their events.
Yes.
So that you can go and talk.
That would be amazing, and that's part of why when Allie connected Leah and I was like, yes, like that is, that's what
I have to jump in here. Sunday, that's why NISA and Monsoon came about, because mainstream organizations such as Alta's could not serve victims of domestic violence, sexual assault, human trafficking the way our culturally specific programs
and
are.
that's exactly
So, you
why
know,
we
if you
refer to
start,
them.
not because we are in rivals, but that's why we came about. I mean, there are 7 culturally specific organizations all of Iowa, and some of them who are not located here travel here. So to be mindful of when you recommend mainstream and you know, then push us into the background, it is probably not a good, because ultimately they will reach out to us.
Yeah.
So you're going roundabout when we are right here. So
I think what I'm trying to say is that we are all complementary.
I agree,
And
but
the
that's why.
complementation is very important, because the service, probably the services that they provide is not all the services that you provide.
Yes, we do.
So
We
it's
provide
very
all the
important
services.
It's very important that the public also knows that they exist. You're already working with your own organizations, the different ethnicities that you work with, but then they also need to know that the mainstream is there, and that the services of the mainstream are also available to them. So it also, I mean, probably what I'm trying to say is you can also invite them to your own meetings so that they make presentations to you based on what they do, and the other way around too.
I'll jump into Sunday.
Yeah.
There is a Johnson County for sexual violence and domestic violence, and all the violences in the state.
Okay.
We are all part of those partners and coalitions.
Yeah.
And so they talk about us, we talk about them, we share clients.
Okay.
I guess what I'm saying in my very many words, that is kind of covered. Where they don't reach, and reaching our population, we notice the gaps. And already we convince the state that they allow us to work, and there is something missing for our populations. They let us, but that doesn't mean we don't work together. There are coalitions and partnerships.
Oh, great. So my question is answered.
I would say locally, we have the Partnership for Consent Culture. I mean, we get together. I mean, that exists, and so that I can learn from them, and we can.
You INPAC, you ANJ, all those acronyms. I'm sorry, I'm using, but it's just partnerships and coalitions in the violence and sexual violence, in all those things. And yes, we work together.
Okay, so my question is answered. Thank you.
You had something
Sarah, you had
to
a
ask, because
No, it was very closely connected to that, so it got answered.
Okay.
Okay, thank you.
So Alta, I have a question for you. because Monsoon and by extension NISA does, it's not case management, it's lifelong services. So people can come and go, they can just change their mind, they can come back, they can, come back after 5 years and say, I need help with a job. Has nothing to do with domestic violence, sexual assault. Is that what you'll do at the shelter?
Within the shelter, that is specifically to DV, but our outreach would still, so after you've left shelter, then that would be part of the outreach program. So we have people that, I actually just talked with a woman that we worked with 15 years ago that came back, and she actually wanted some peer counseling. She had a grandchild now, and it was bringing some things up, and so we just spent some time. So yeah, that doesn't expire, but it's not in shelter anymore, then it's a different set of staff.
So what happens if, because as we all know, and if, those who don't know, the statistics say women leave, again, when I say women, partners, but most of the victims are female-bodied. But if women leave, or I shouldn't say female-bodied, female-identified, sorry, who leave 7 times before they finally leave. So what happens, would your shelter take them back every time? Just wanted to.
Or more.
I assumed, but I just wanted it, set out.
Yeah, so we meet you where you are the day that you need us. I mean, that changes. And every story is different, every person is different, so, yeah.
So, just going back a notch to the services being provided, does Monsoon provide a 24-hour hotline?
Yes. We have, so our hotline works in a way that, as does NISA, we have our, I'm assuming, right? No,
Yes,
never mind.
we
provide 24 hours, so we have everybody has, it's part of the whole staff requirement, so everyone has a phone duty every week, so that, yes, so it's 24/7.
I actually have a question for you guys, if that's okay. If people call our 1-800 number, do they then refer, would they give them, especially if language is a barrier, then would they transfer that line over to you, right?
Not because y'all will have to give them our number, our hotline number.
Oh, I guess, yeah,
So,
they do like a call
because I think
transfer.
yours is central, kind of,
Yeah.
right? And then they direct them to call. So we don't have a link, I don't think, because it, while we have one number.
Well, yeah, yours is more of an
change-
on-call
yes,
system.
so,
Okay.
yes.
I
So-
assumed that they did, but I thought I.
So, but yeah,
before I made
anybody
calls,
can
they-
call that number, our hotline, and get directly to the advocate who is on duty, yeah.
Excellent.
Yeah, this week it's me. That's why I have to step out. Yeah, and also if there's nobody is able to man the calls,
Right.
it defaults to the crisis line. So if, for example, in the middle of the day, if I'm getting that call, it means the others can't take the call,
Right.
or 24/7, we have to be able to take the calls.
Right.
Because
Well,
in
yeah.
that field, violence doesn't really care
No.
when it's happening. Or unfortunately, we don't care when we're being violent on others, whether it's in the middle of the night or.
Sorry, it's past 11 o'clock, and